Myanmar has detected its first transmissions of at least 2 new COVID-19 variants as it battles a rise in new cases. Around 11 cases are linked to the more infectious Alpha and Delta strains. The healthcare system has taken a hit 4 months after the military coup. Many workers are on strike and some vaccination programs have been halted. Aung reports.
The battle against COVID-19 may seem to have taken a backseat in Myanmar amid the ongoing anti-army protests. But things may now change. On Tuesday, the army said 11 people across the country were infected with new variants of the virus. The patients are spread across 4 different states and regions in Myanmar. 4 are from Mandalay, the second largest city, followed by the 3 cases in the southern region of Tanintari. Myanmar's largest and busiest city of Yangon had 1 infection. The Myanmar army has urged people to adhere to COVID-19 regulations, which were extended to the end of this month. They include the ban of large-scale gatherings, the seize of international and domestic flights. But people are more focused on protesting against the military than worrying about the spread of the virus. Since the coup, Myanmar's healthcare system has taken a hit. Healthcare workers and volunteers on strike mean fewer patients have been tested and treated for COVID-19. After the coup, the Myanmar army says it wants to manage the pandemic. But without support from volunteers and healthcare workers, it couldn't do much. Under the army, some 2,000 swab tests are carried out in a day. That's a huge drop from 18,000 tests a day under State Counsellor Aung. The army is also struggling to maintain quarantine centres. Local media recently used this photo, which shows one such facility built under the army's rule. This one here shows a centre under Misuchi. But the real battle here isn't about comparing who's better at managing COVID-19, but how that can be done now given the constraints, healthcare workers on strike and the threat of deadlier and more infectious variants. The Myanmar army says that the country now has some 3.5 million vaccines, with an additional 28 million arriving from countries like Russia and China. But some sources tell me that Myanmar's vaccination program has been put on hold due to lack of manpower. Another healthcare source says that the program could be restarted in the 3rd week of June. But at the same time, Myanmar is seeing ongoing clashes and protests. Humanitarian groups, both inside and outside of Myanmar, stand ready to help. So the big question is this: can this crisis be turned into an opportunity that could put these clashes on hold and create an inroad for humanitarian aid to enter Myanmar? Leong Wai Kit, CNA.